Hello and welcome to McDougall's Medicine with Dr. John and Mary McDougall. I'm their daughter and the CEO of the McDougall program. My name is Heather McDougall. I'm excited for tonight. We thought we'd just keep it really casual and answer some questions from the audience. I've got lots already that people have emailed me, so I'm excited for this hour. Welcome, Mom and Dad, Dr. McDougall and Mary. How are you?
Hi.
Yeah, it's good. We get to spend a whole hour not having any structure at all. We get to just talk about whatever you guys want to talk about. I was on Chef AJ's show last Wednesday, and I gave a talk on vitamin D. And I only answered questions on vitamin D. And I told him, I said, look, you guys have questions about your personal health and other things that are going on, or friends or relatives. I said, 5 o'clock Sunday. That's when we'll answer general questions, but not off topic. So I had a lot of fun. I think it was better organized. Chef AJ's. Well, we ended up behind around like 2.5 hours.
Shows are always so long.
I know.
Well, she's so enthused about it. Of course, it changed her life. And those of you who don't watch Chef AJ, she's on every day. Just kind of look her up, and she's well worth the trouble. There's lots of she has lots of different guests. She'd make a great MC. I mean, she could be, the Johnny Carson of diet and health. She's that good. And she has lots of guests on. They have different opinions, different points of view. And, I tell her, fine. Got to be, she's to be a hostess. You can't sit there and criticize somebody and say, well, Dr. McDougall thinks you're crazy.
Well, but she has a limit as to, she doesn't have people on that believe in the paleo or the keto diet.
No, she doesn't go that weird.
She's pretty limited. She has plant-based people, I think.
But anyway, on Sunday night, we have a chance just to get together with you and see if there are things you want to talk about. And, this is the time to ask things about your health and how you should be approaching your medical doctors and whether you should be taking the pills or not, and whether you should go on with that heart surgery or postpone it, or whether or not you should have a mammogram, which you started talking about last week. And I wrote one of my longtime friends. I wrote Peter Gertzke, who was the head of the Cochrane collaboration for 23 years. And he wrote Mammography, Truth, Lies, and Controversies. He wrote a book that I encourage people to get if you want to argue with your doctor about the fallacies related to mammography. We started talking about it last week. The reason that doesn't work out is because of the fact that by the time you can find the disease by mammography, it's like 14 to 17 years in its development. And if you take and throw in every kind of breast cancer, it's on average 10 years. If you throw in the breast cancers that women find themselves, it's been growing for, on average, 6 years. And the reason is a woman will find ones that are growing faster. She'll be the one that finds them. Whereas the ones that are slow growing and stay small for a long period of time, those are the ones you'll pick up later on by the more refined instrumentation using x-rays.
Women that find it, they don't usually get told by the doctor, oh, you're lucky, we found it. It's been growing for 10 years, but, we found it, so you'll have a few more years to live. Well,
more than that, Mary, they rush them into it. And the patient feels rushed like, oh, I found it. I've got to catch it in time. If I delay it by a day, if I delay it by a month, and then the doctor says, well, I'm sorry, I'm going on vacation with my family for the next month. I can't schedule you until 6 weeks from now. And you go, wait a minute, I'm dying. This rapidly growing cancer you just found, I'm dying. Well, see, the doctor knows. The doctor knows that it doesn't make any difference whether you operate on it the day you find it, or even if you waited 35 years and operate on it. The difference would be the tumor would grow in your chest. But as far as living, you're not going to live any longer, because by the time it's diagnosed, it's already spread throughout the body. And anyway, I wrote Peter, who's been a longtime friend, head of the Cochrane collaboration for 23 years. This is like 50,000 scientists that he saw worldwide, over 150 countries. And they published a brochure on they published a brochure. In fact, you can look it up on the Cochrane collaboration. Published a brochure that, I thought it went to 13 different countries, and I guess it initially did. It's now it's in 15 different languages that tells women not to get mammograms. And of course, our conversation started out between Peter and I that he was getting in all kinds of trouble. He says, they're taking my stuff off YouTube. Those people who object to what I have to say about psychiatric drugs, and he puts in an honest opinion because he can read the science. He knows the science. He's published in the big 5 medical journals. This guy's he's known by pretty much everybody who's in the business. If you're interested in good science, or you're interested in breast cancer, Peter Gertzke from Copenhagen. Anyway, he agreed to do an interview, Heather. And so sometime this week, I'm going to do an interview with Peter and see what he's up to. And he's a fighter, I want to tell you, but he's fighting for you guys. He's fighting for you to get the truth. What I tried to explain to you on our last visit last Sunday was that, this tumor grows at a very regular rate, which, by the way, varies greatly. It's called a doubling time. And it doubles on average every 100 days. But some tumors double every 30 days. Some double every 900 days. You don't want it doubling fast.
So if you change the way you eat, does it double slower?
I believe so. I believe that's what the research says, Mary, is that you can change it. You change it in 2 ways. One, you improve your immune system. And the second is you stop feeding the cancer things that it loves. One of the things that cancers love, breast cancer, for example, it loves estrogen. It loves the female hormone. And so if you take estrogens, like you used to do it for hormone replacement therapy, a woman was taught once upon a time back in the 70s that she could preserve her youth by taking these Premarins and other types of estrogen progesterone pills. And then they started getting a lot of breast cancer, and the best breast cancer was shown to grow much faster under the influence of estrogen. And then they developed drugs that block the estrogen effect, like tamoxifen or aromatase inhibitors. In fact, I got a question this week, and I might as well answer it now. What do you prefer for estrogen blockage? Do you prefer tamoxifen, which is what I was trained with back 40 years ago, or the aromatase inhibitors? Well, I was trained a certain way, so I have a preference. But as far as reading the science goes as to what is more advantageous to you, one or the other, you can make an argument in both directions as preferring tamoxifen versus aromatase inhibitors. They both block estrogens. And so you'll find doctors today prescribing, either of the drugs. They may have a preference too. The other thing, and Peter talked about this in a paper that he wrote that I could share with you. He talked about how it really didn't make any difference which drug you took. He thought the drugs were advantageous to block estrogens. And he also mentioned you could take out the ovaries, which is an option I always offer women when it comes. But getting back to the diet part, the question you asked, can you change the course, is the Western diet produces a tremendous amount of female hormone, tremendous amount of estrogen, so much so that a little girl starts her reproductive life when she's still a child. The little girls develop breast buds and pubic hair when they're like 9 or 10 years old.
So how do they get this estrogen? From the food that they eat, or does it make your body make more?
Does both.
Okay.
They give estrogens to cows and pigs, and maybe chickens too. But they give the hormones to these animals to make them grow faster. And so
Okay.
They do this in the feedlot. In fact, in Puerto Rico, back when I first started reading about this, say 25, 30 years ago, little boys actually were starting to develop pubic hair when they were 3, but little girls when they were 3 years old, they were starting to develop pubic hair, and I can't remember if they had signs of bleeding or not, but
Oh, that's terrible.
yeah, from the eating, I think it was chickens that they were getting all the estrogen from. Anyway, we have some bans against that somewhat in this country, but they still give hormone shots to these animals. That's one way. The other way is that being overweight produces more estrogen, because when you're overweight, your fat cells, which make estrogen, they actually take adrenal hormones. So the adrenal glands are above your kidneys. And it takes these adrenal hormones and it converts them into body fat cells into estrogens. It's called estrone. So that's another way you get it. The other thing is that plants, some of their components, including the dietary fiber, blocks the estrogen from being absorbed in your gastrointestinal tract. So it stops the recirculation of estrogens that happens. You make estrogens, you excrete them in your intestinal tract, and they get reabsorbed in your intestinal tract. Well, when you eat fiber, you plant parts, that blocks the reabsorption. So that's another way. Another way is to grow bacteria that turn some of the things you eat into estrogens. There's just a whole bunch of mechanisms. And
But I mean, I think I remember you telling me not too long ago that Lancet actually put an article out that told people that got cancer, maybe it was just breast cancer, that they should change the way they eat.
well, the American Cancer Society did this in 2015.
Oh, okay. I
That was-
thought you showed me an article in Lancet
Oh, you
not too
know,
long
there's,
ago.
it might have, Mary, there's so much. I mean, the truth keeps resurfacing. You just don't hear it because what you learn is dominated by the drug companies. So if they have a newer, fancier, more profitable, the old drug went out of brand name. It's now generic. They can't make money out of it. So what are they going to advertise? They're going to advertise the new drugs, and whether they be beneficial or not. And it turns out, I don't know. And I still have the jury out on many of the new preparations they have, but I'll listen to what they have to say. I'll look at the science. And by the way, in Peter Gertzby's article that he told me about, one of the things that's got everybody so upset about him is he talks about on this article back the trialist, there were British studies that were done when they looked at women that were treated with breast cancer, and they got various options. They got tamoxifen, or they got cancer chemotherapy, which works, by the way, by knocking out the ovaries. It's chemical castration. So they got tamoxifen, and then they got cancer chemotherapy, and they compared that to women who had their estrogens removed, and they found there was
not their estrogens.
their ovaries removed.
Okay.
Their ovaries removed, which is their estrogens removed.
I know, but I wanted you to make
Thank
it
you.
clear.
Anyway, they had this trialist study, which came out in the early 80s, the latest, showed this, and I read the trialist studies, and what this says to me, it doesn't make any difference. All right, so what they started to do was they divided the type of cancers into estrogen positive or estrogen negative. And the estrogen positives occurred in postmenopausal women more commonly. And they were the ones that were told that they should take the estrogen blockers. Okay, but premenopausal women, they generally turn out to be progesterone negative. And they were told they have to take chemotherapy. And the trialist study showed it didn't make any difference. You could either kill the ovaries by these drugs, these powerful drugs. And really the only women that benefited from cancer chemotherapy, the methotrexate, the Cytoxan, the 5-fluorouracil, the adriamycin, the things that I was asked to prescribe to patients when I was a young doctor. Only those women who they knocked out their ovary function, stopped menstruating, benefited survival-wise. So that's the way that this former kind of chemotherapy worked. It killed the ovaries, chemical castration.
So if a tumor is not estrogen positive, then what difference does it? Does it make any difference?
It doesn't. The trialist study showed it didn't.
Okay.
Whether you knock the ovaries out by cancer chemotherapy. But what I was getting to is they divided the business up. The oncologists divided the business up so that the postmenopausal women, they got the business end of the estrogen blockers, and the premenopausal women, they got chemotherapy. And I could never understand why do you choose one over the other when the trialist study showed you get the same benefits. It's not getting too complicated, Mary, but it's a deception. I mean, you got to realize, as I look back over my career, is I went through all of this development of all modern medicine. The surgeries, the chemotherapies, the radiations, the blood pressure pills, the statin drugs, all this stuff. I was privileged to read as it happened, and I applied it to my patients, and I read the science. And it all happened in the last 50 years. And I just feel so privileged that it was my time. But then again, I read these articles like the one that Peter sent me. And I'll try and send that over to you, Heather, that Peter sent me. You can put it up because it's available free, open access, and you can read it. It's just very complicated, but you'll get the gist of it.
All of his stuff is very complicated. And at least you break it down so people can understand what you're saying.
I hope so.
Because, I mean, it's scary. I mean, if you're told you have breast cancer, you're scared. And all you hear is the word breast cancer. And you get really scared and you don't know what to do. And you want somebody to tell you what you ought to do to live longer. And there's so many answers out there, and it seems like nobody really has the right answer that they want to hear, except maybe you.
Well, I think I got a pretty good answer.
Well, I know, but they don't like to hear that. I mean, it seems to me like younger and younger people are getting breast cancer these days. And I guess that's because we have early screening.
Anyway, there's the article, Heather. If you can pull it out and put it up for people if they want to read it. Like I say, I wouldn't give it to you if it wasn't open access. It's not copyrighted, so you can read it. And it's scary. You should be scared. You should be frightened of what's going on because you're getting care that is dishonest. It's based upon money, and I know you feel helpless. And as you've heard me say so many times before, get out of the business. You're not going to win. It's the attitude I take with Mary and I and our family, is I want them to be not involved with the business. And when occasionally they have to be, I fear for them. In fact, I often end up in the doctor's office along with a family member because, they at least need my interpretation of what's going on, if not my argument. And of course, I try and offer this to all of you folks too. I offer you a challenging second opinion. So, by the way, I noticed you put up the book, the women's book, because it's Breast Cancer Awareness Month, for free on our website.
Yes.
So when you get done to the checkout, there's no charge for the women's book. And we've had McDougall's Medicine, A Challenging Second Opinion up as a free book too.
Well, I'm sure that we'll do that again,
We'll
probably around Christmas time.
We have six books that Mary and I own that were given back to us by our book publishing companies. And so we can give them to you for free. We own the rights to them. And the McDougall program for women, which goes into a lot of the stuff about breast cancer and hormone replacement therapy, et cetera, is there for you.
Thank you. Well, I'm excited to hear your interview with Peter Gertzke.
Yeah, we'll do it. We'll do it sometime, Tuesday or Wednesday, and then we'll put it up and we'll let everybody know. That's one of the reasons you want to be on our mailing list, is because, different opportunities that come up, including different lectures. We want you to be aware of them so you can get this information. The problem I have with Peter is to kind of bring him down to a common level of discussion, because he's one of the smartest men in the world when it comes to cancer research. And
you have to be really, I feel like you have to be almost a medical professional to read his book about mammography.
Oh, it's terrible.
Because it's so complicated. It's really hard for people. It's almost like you take this into your doctor and you say, here, read this and then tell me what I ought to do.
Mammography, Truth, Lies, and Controversies. That's the name of the book. You can get it on Amazon. It's like $51. Not
really?
Cheap. Yeah.
Oh, wow.
I was just looking at it today. And when I first read this book, I liked it because, again, that was my life. I saw these studies come out in the medical journals when doctors got excited about talking about them. And then when I read them, I came to a different understanding than what was being said as the general comment. I said, I don't see that. I don't see where you end up giving premenopausal women chemotherapy and postmenopausal women hormone blocking therapy. They all benefit for the same reason, as you're removing the ovaries. And of course, the test of time is that, people who are aware of the literature, like you'll read in this paper that Heather may be able to put up for you. You'll read in the paper that you'll read about the trialist work, and that doesn't make any difference. But even today, you go into the doctor, you don't stand a chance. You don't stand a chance. And that's where, for the first time in this hour, I will plug our program, Heather. And that is the only time you get to be a McDougall patient and really have the full opportunity of my attention is if you take the 12-day program. And then you become a McDougall patient. And from that day on, unless you fire me, from that day on, you can ask questions. I'll do an in-depth discussion for you and help you out the best I can. I've even been known to write letters to other people's doctors and to call them on the phone and talk to them. I've been known to go into the doctor's office of my patients. I have.
You have.
Believe me, the conversation changes drastically when I walk in there. But I know you can't have this easily. Each time you get more involved with us, the more likely you are to get our attention, obviously. And everything's free on the website. Everything's free in the books and the YouTube webinars I've done. But
Well, that's why we're doing these Sunday night shows.
I
too.
guess that's why we're here every Sunday at 5
So they
o'clock.
can ask you questions.
But anyways,
Right.
it's
I've
breast
got
cancer.
lots of questions coming in.
I just want to conclude by it's Breast Cancer Awareness Month. And this is a holiday that was set up by one of the drug companies that makes tamoxifen. Okay,
Really?
yeah.
Oh, I didn't
They're the
know
ones,
that.
oh yeah, they're the ones that started all this. I think it was Roche, but I have to check. If you go to our website and you type in the question line, you type in Breast Cancer Awareness Month, you'll see an article I wrote on this a dozen years ago. And the details are there, what the drug company was that set it up. It's Breast Cancer Business Month, Industry Month, breast cancer, because everything's set to sell you more, more testing, more treatments, get more people involved in the business. The ultimate in disease mongering. I said I'd quit, didn't I?
It's
Well,
hard.
Heather's got questions, so. you'll
I have
get a
lots
chance
of
to
great
talk again.
questions coming in. So along the same lines of cancer, this is about skin cancer. So Susan wants to know, she's been diagnosed with basal cell cancer on her sternum. She's found a cream online called Curaderm that she's been using, but her doctors want to do Mohs surgery. What do you think?
I don't know that I remember much about Curaderm, but I've run into it before. Because I have actinic keratosis, because I spent 15 years in Hawaii, 5 years on a sailboat. And, I'm a lily white guy and I shouldn't have been doing what I did in the sun. So I know a bit about these skin cancers, and the drug that I have been recommending for almost 30 years and personally using for probably that long is a drug called imicodone. I think it's I-M-I-Q-U, I'm not going to spell it. It's Aldara, A-L-D-A-R-A, imicodone. Aldara 5% cream. It was originally developed for venereal warts in women. They catch viruses in the vagina and they get warts, and you put Aldara cream on it, and the body's immune cells attack the viruses and killed them. A very effective treatment. Well, somehow or another, they discovered that the Aldara is very effective at treating actinic keratosis, which is a condition where you don't quite have a cancer. It's precancerous. It's due to sun damage. You diagnose it by some roughness in your skin, maybe some discoloration, maybe it gets a little red, a little bit painful. You'll just know that there's something, the skin isn't smooth anymore. And you might even get some definite spots occurring. And then it gets a little bit more aggressive and it develops into a real cancer. It's called squamous cell. Or it can develop into a basal cell. The difference between squamous and basal, you can tell by looking at them, but generally the basals are smooth. They're kind of lumps. Squamous cells kind of an eroded area. The FDA approved the treatment of actinic keratosis, squamous cell carcinoma, and basal cell carcinoma with the use of Aldara cream. Okay, and again, I've been using this, I've been recommending to patients for 30 years, an FDA-approved drug. It's even used in experimental settings to treat melanoma, but I don't prescribe it for that. So just be aware that there's literature you'll find on treating melanomas with Aldara.
Well, anybody should be able to get their physician to prescribe Aldara, right?
Easy, easy. Well, unless you go to a dermatologist. The problem with the dermatologist is that they don't make money on this cream. You get a prescription, okay, it costs you $16 to $50 for 12 packs. You're gone. You know, the problem's cured. You're out of the office. Whereas if the doctor offers things like liquid nitrogen treatment or laser therapy or Mohs, which is where they take a little bit of the tumor off, little, send it to the pathology, looked for the area where they stop getting tumor cells. They make, thousands of dollars doing this.
They don't do it all. They do it all at one time, or they do it.
You lay
take
down
a little bit. And,
You lay down. Yeah, they do it all at one time, but they take
Okay.
a little bit,
and
cut a
then
little bit,
then
and they send it to the pathology lab
while
and
you're
say,
still laying there.
you're still laying there. You're still either anesthetized or, local anesthesia or whatever. You're still there. So anyway, that's why you recommended Mohs, is because that's where the money is. Now, if you went to the doctor, you said, if it wasn't a dermatologist or somebody else that makes a living with this, you would get a comment back like, oh, you can't do this because you can't use the Aldera because it's so painful. I just wouldn't put you through all this. Excuse me, to use it for 7 days and the area that's affected starts to break out. And then for another 7 days, you got a rash like poison oak. You don't want to go to your 50-year reunion or your a wedding or something, but you got to plan things because you're going to look like you got poison oak. And then over the next week, it's going to go away, heal. And it almost always leaves nothing. Now, that's not always. I mean, I've seen it leave, a big hunk out of people's under their skin. Indentation, yeah. But it's much less than you would have had if you had the Mohs procedure done where they end up cutting, your nose off. Anyway, Aldera, your doctor should prescribe it. It's inexpensive. If it failed, you can always have the Mohs procedure done. You'll find lots of, and this is what I ask all of you is, look, I'm offering you a challenging second opinion for free, by the way. At least take the trouble to find out what I have to say, and then take what I have to say to the doctor, either in your own words, or take the materials that I have written or put on video and say, Doc, why can't we try this first? And if it doesn't work, these are chronic diseases. They've been going on for months and years. If it doesn't work, I'll come back and you can slice my chest open. You can give me brain damage from bypass surgery. I'll let you, doctor. But first, let me eat potatoes. That's all I ask. And it's the same thing with the Aldera cream is, give it a try. You can look it up right now. You can look up FDA approval and basal cell carcinoma, and you'll see that Aldera cream is FDA approved. Put it on. You should get tremendously positive benefits. Yeah, you'll have poison oak on your whatever, your hand, your face, your leg. And it won't be pretty for about a week. So,
but that's it. Then it's done.
Like I said, when they first started selling it for warts, before it really got the rage as far as treating sun damage, actinic keratosis, basal or squamous cell carcinoma, it was about $200 for 12 packs. And then they discovered that it really was highly effective against skin cancers, and it went up to $1,000. And now it's generic. And you can get it for $16 to $50 for those same 12 packs. Yeah. Or if you belong to certain insurance companies like I do, Kaiser, I get it free. Yeah. And I've been using it ever since. I mean, I use it probably every 6 months or so. I've got some areas that need to have some more treatment. So if you see me online with a little spot here or there, you know that I'm catching up with some ill-advised exposure to the sun when I thought I was immune.
Thank you for explaining that. Okay, next question. If you are iron deficient, do you have any suggestions? Richard would like to know.
Yeah, the first thing you need to do if you're iron deficient, and every doctor will tell you this is standard medicine. In fact, if it's not done, it's reason for a lawsuit. The first thing that you need to do when you find out that you have iron deficiency is you need to look for a source of chronic bleeding. There are two possibilities. I mean, there are other possibilities. There are two common possibilities. One is you could be bleeding from your intestinal tract, and that's both for men and women. The other is you could be losing blood from your uterus, which could be due to excessive menstrual flow, to endometriosis, which is a precancerous condition, or it could be due to uterine cancer. As far as the bowel goes, it could be due to colon cancer or polyps or ulcers that you have up in your stomach area, various kinds of colitis that you get. So that's where it needs to be looked at first. Is there a cause for you to lose iron chronically over months to deplete your iron stores? And then once you decide that's not the problem, then you got to decide, well, what else can I do? The second thing to choose is a diet change, of course. I mean, at the same time, you ought to be doing that. At the same time, while they're looking for blood sources, loss of blood, you ought to be changing your diet, because dairy products are the most common cause of iron deficiency anemia in children. Children, they wouldn't have menstrual blood flow loss. They're not going to have bowel loss. Well, they will if they eat dairy. Yeah. You know, so it's called Heiner's syndrome. It's a leading cause of iron deficiency anemia in children. It's been known for 80 years. And you can't correct this anemia unless you take the kids off the milk. The milk does two things. One, the calcium and phosphorus in the milk, complex iron. There's no iron in milk. Okay, so like nothing, virtually. And so what they do is they take iron that you might have gotten from green beans or from beef, and it makes insoluble complexes, so the iron no longer can be absorbed. Plus, the milk protein causes microscopic bleeding, which is what it causes in these children. But it also causes it in adults. And in adults, they have diseases related to the milk, the cheese, the beef, the chicken, the fish. You got stomach ulcers, you got hemorrhoids that bleed. You know, colon cancers, polyps, colitis, all due to the food.
But you know what people think about when they think about iron? So they have to eat meat to get their iron.
Right. That's one of the pitches of that's unique positioning from the dairy industry, because the meat has a lot of iron in it, but so do vegetables. In fact, part of the photosynthesis process. What is it? A myoglobin? No, it's not myoglobin.
No, don't.
Anyway,
Don't ask me that one.
Right. And part of photosynthesis involves the use of iron. So plants have to use iron. They're loaded with iron. The thing is, it's a kind of iron that's less readily absorbed than meat iron. So there's the pitch.
Wow.
But if you eat vitamin C, which is only in plants, if you eat vitamin C, then the iron absorption ability is kicked up dramatically. So, you know, no one gets iron deficiency just from excluding meat from the diet. You know, on a vegetable-based diet, it just never happens. Well, let me add one more source of iron deficiency anemia. It has to do with running. And I forget what they call it, but it's when you slap your feet down on the cement. Okay, you break the blood vessels in the feet, and you break up the blood cells. You don't break the vessels, but you break the red blood cells, and now they're no longer, the iron is freed up. It's excreted from the body.
I never heard that one.
Yeah, for runners get this from marathon, triathlon runners, and it used to be talked about a lot. But they have something else to talk about.
That's interesting.
So that's what you do. Okay, and then you say, well, do you add iron? Well, okay, you can add iron, but you're on a very iron sufficient diet, eating the kind of diet I recommend. You say, well, should I add raisins because there's really high in iron? Well, you could do that too. But it really doesn't matter, because the body's going to pick up all the iron it needs from your food. It's really hard to force the situation. If you take iron pills, the body will only absorb a little bit of that iron in the pill, about 20% of it if you're severely iron deficient. If you're iron sufficient, then the body doesn't take in the iron, because what would happen is if the body took in the iron, this all happens at the gut wall. They're really smart cells dividing what's in your intestine and your bloodstream. And these cells, they don't allow iron to be absorbed if you got plenty in your body. Why not? Because what would happen is you develop hemochromatosis. Hemochromatosis, which affects the liver, gives you liver failure. Iron is deposited throughout the body. It's not a good thing to happen, but the body doesn't let it happen. Okay, here's one you've not heard, Heather. There's a tribe in Africa. You only learn about this on the 5 o'clock show. There's a
I learn
tribe in
something
Africa,
new every time.
in rural Africa, that these tribes have a very high rate of hemochromatosis. And it couldn't be figured out why until they looked at their method of brewing beer. And what they did is they brewed beer in iron pots. Now, there's something about the acidic nature of the beer, some other component of the beer, that caused a lot of dissolution of the iron from the pot. And this tribe had a high level of hemochromatosis. You can look it up. I bet you can find it if you look for hemochromatosis and beer in an African tribe. I bet if you pull those three in, you'll get that story.
I never heard that one either. That's good.
It's not one I tell often.
You have all these little tidbits.
So yeah, you could take iron pills if you wanted. They constipate you. They cause your stool to be black. And by the way, one way you can tell if you're bleeding from your intestinal tract is you have black stools. They're black and tarry. That's how we describe black tarry stools. And you can get dark stools from eating beets, and if you eat animal foods, you get darker stools. But black tarry stools, that's not good. And they're distinct and they smell different. And you'll have no doubt that something's not right if you're bleeding from your intestinal tract. Grossly bleeding, large amounts. If you're bleeding microscopically, it could sneak by you and you get iron deficiency.
And that would still cause iron deficiency over time.
Yeah, that's going on for years, months, years. Heavy menstrual periods every month. And by the way, the heavy menstrual periods are due to the food. Going back to the discussion we just had on estrogens and breast cancer, the same thing, the dietary things that happen that cause high estrogen levels on the Western diet. And by the way, in chapter 5 in the book that Mary and Heather and I are giving you, chapter 5, in the book is a whole discussion of the dietary, of the women's book. It's free. It's on the website. It's chapter 5. It gives you a whole discussion of how the diet causes higher estrogen levels. And it's not complete. I mean, there are other things that are going on and other things I could probably add to it, but it's the basic information with the references in the McDougall program for women. Anyway, you cause these heavy menstrual periods from heavy estrogen levels eating the Western diet. So you have more blood loss. Do you think everything has to do with diet, John? I tell you, there must be at least a few out there that are thinking, this guy's a broken record. Well, the food is crucial. The reason I keep sticking with it is because it works. I've been doing this for 47 years now. I'd go on to something else, some kind of supplement I can make a ton of money off of. Buy a big fancy yacht, sail it around the Caribbean.
Yeah.
So once in a while, there's something that you say has nothing to do with diet.
Yeah,
Once in a while.
Yeah, once in a while. There's a few things.
Yeah. And besides that, you need a good diet anyways.
Well, exactly. I mean, you'll feel great, even if it doesn't cure, X, Y, or Z, you're going to feel, have more energy and have great bowel movements. And, the list goes on and on.
I try and give people the analogy. If they had a pet horse or, a racehorse that they owned and the horse broke its leg, would you put it on cat food? There's an ideal diet for a horse to run and win the Kentucky Derby. And that same ideal diet heals the bone in its broken leg. The same thing with you. If you drop a bowling ball on your foot, you still need to eat a good diet, but it's not going to stop the damage done by the bowling ball.
Absolutely.
But you're more likely to heal quicker. I had to throw that in. You're more likely to heal faster from that bowling ball. I don't know. That's not true. Maybe we'll do a randomized controlled double-blind study and prove it.
Thank you. Next question from Nicole. How do you increase your vitamin D levels besides taking a supplement, especially if you have dark skin?
You go out in the sun.
Well, you have to stay out in the sun a longer time.
Yeah, you have to stay out in the sun a longer time. It's because that's your nature. You come from an ancestry that was near the equator. That's why you have darker skin, because the melatonin, the pigment in the skin, protects you from the sunshine.
From getting burned.
Well,
I mean, you need some sunshine.
You'll eventually get burned. Even black people get burnt. But it puts a tremendous amount of resistance up to getting damage from the sun, burn. It's just like a redhead who's
really pale.
Yeah. They're always talking about how they always have to wear hats and so on. The pigment in your skin protects you from the sun. So your family's from the equator. You move from whatever equatorial zone, and there are 25,000 miles of them that go around the equator, and you move north and south. Well, you're living out of your environment, so you've got to get more sunshine. And you say, well, I can't. I work all day. I got to wear clothes. I can't afford a vacation. What do I do? Well, buy a sun lamp. But the amount of sunshine you need to get all the vitamin D that you need for the year is the time that you spend on a summer vacation. So it's a fat-soluble vitamin. It's stored in your body fat. The half-life is 2 months. The half-life of vitamin D3, which is the time that you take, is 15 days. But of all the vitamin D metabolites, it takes 2 months to get them, to knock them in half. So anyway, you got enough to last you the whole winter based on 2 weeks of a summer vacation in a sunny environment. That's what you need to do. You don't. There's a whole lecture I gave it on Chef AJ's show last Wednesday.
No, yeah, but you have a lot more to give, and you're going to give another whole lecture on vitamins that people need.
I gave a teaser.
Yes, I know.
I gave a teaser. And anyway, that would be well worth looking at. And what I tried to explain to you is these supplements are hazardous. And because it's fat soluble, you store it in your fat and you bioaccumulate it. Even if you're taking one pill a day, say you're taking 10,000 units a day, which is a common dose. 10,000 units a day, you'll find recommended on vitamin pills that you buy off Amazon. You're taking 10,000 a day just to get the vitamin D3, which is the component that is most active. Just to get the vitamin D3 out of the system, it takes 15 days to cut it in half. So 15 days later, you got 5,000 IUs still in your system. All right, so you took 10,000 one day. The next day, you take another 10,000. And 15 days after that, half of that dose is there, but half of it's still in your body. And that's how you bioaccumulate it. I can't go through all the math with you, but if you're only getting rid of a half of every 15 days, then if you're taking it every day, your accumulation becomes huge.
But that doesn't necessarily show up in the vitamin D test that you would get.
Yeah, it should.
It should?
It should.
But, there are so many people that flunk the vitamin D test.
Well, that's with the sunshine.
Yeah.
With the pills, you can see, if you get pills or shots, you can see their vitamin D levels in their blood.
Okay.
Yeah, but not by sunshine. By sunshine, it's highly variable. But if I give you enough pills or enough shots, I'll raise your D level to 130, 150.
But that's not good either.
No, because you increase your risk of falls and fractures. And you get vitamin D toxic. Go out in the sun. When I was a little kid, we never talked about vitamin D as a vitamin. We called it the sunshine vitamin. It only becomes a vitamin if you live in an unnatural situation. It's a hormone made by the skin. That's what it is. And if you fool Mother Nature, you're going to get hurt. Guaranteed.
So next question, what would you recommend for someone that has eczema?
Well, I think they should change.
See, what do you think?
Heather, I tell you, it's because that's what works. I'll never forget the first 7 years I spent with my sister. She was, my older sister's 2.5 years younger than I am. And the first 7 years of her life, she was in misery, going to doctor after doctor after doctor because she had such a severe eczema over her perineal area and down her legs. She was bloody from the scratching. And my parents did everything they could for her. And they finally took her off the dairy and eggs. Cleared up in a matter of a few days. That's the first experience I had with diet and eczema was my sister. But read it on the internet. You'll see that it's an allergic disease, and it can be allergic to food. And the most common foods to be allergic to are dairy and eggs. Those are the two most common. So, at the very least, you ought to try and get dairy and eggs out of your diet. And if that doesn't work out, how about the whole McDougall diet? You'd be amazed at what happens. And how about the whole McDougall diet with the addition of avoiding gluten, the celiac component? And how about the McDougall diet and add on to that the elimination diet, which is in my May 2014 newsletter, free. If you're not cured, I don't know what else I can do for you because it's not going to happen. You're going to get cured. The next thing I do is I'd send you for a water fast over at Dr. Goldhammer's place. You think you're going to have eczema related to water? Ha ha ha. Not going to happen.
Thank you. Next question from Michael. He's been following your diet and teachings for the last 8 years. He's cured his type 2 diabetes, kidney stones, and feels really great. However, now he's showing signs of Parkinson's. He's 81 years old, and he's worried that if he goes to his doctor, he's going to start talking about L-DOPA. And he's wondering if he should go that route or what he should be doing. I
think he should. L-DOPA is an amazing drug. Cinnamon is what it's packaged with. It's L-DOPA, levodopa. The reason levodopa, it's what gets into the nervous system and it blocks a lot of the symptoms of Parkinson's disease. And it's a very effective drug. Almost everybody with Parkinson's who has significant disease is on cinnamon. For cinnamon, it combines L-DOPA with something else. I forget what it is. So that it gets through the blood-brain barrier because the L-DOPA itself is blocked at the blood-brain barrier. So it gets through the blood-brain barrier into the central nervous system where it has this effect. And the improvement is overnight and does no harm that I'm aware of. And it's really inexpensive.
So there's something you actually recommend a drug for.
Yeah. But I have to add, no, the diet's not going to do anything as far as slowing or stopping your disease. This is due to poisoning that occurred in your earlier years. It's due to organophosphate poisoning, pesticides. And you have the genetic tendency toward it too. I mean, you're 81 years old, so you've been accumulating pesticides probably your whole life. In fact, I bet if we had you on, you could tell us stories of your farming experiences and so on, that you were exposed to working with sheep. The typical sheep dip is organophosphates.
Or I remember when we were kids, they used to spray for mosquitoes.
We used to have these mosquito bombs. We'd go into a tent and we'd take a shut off, we'd set off this bomb. Don't want to use a fly swatter. You got to aerosol your whole living quarters. We got exposed a lot.
Well, and I remember where we lived, we had this truck that used to go down the street with these spray things off the back end of it, and it would spray stuff to, I don't know, kill all the mosquitoes in your area.
We used to see that when we went to the drive-in theater. All the kids would get out of the car and they run behind this cloud of, you're right, organophosphates are every place. Anyway, it's damage done. There's a particular area of your brain called the substantia nigra, which is when you cut the brain, you see an area of brain tissue that's dark, nigra, okay? Substantia nigra, and that's diseased, and it's diseased caused by organophosphates, pesticides. So, that's over the dam, so to speak. And what you need to do is you need to keep yourself comfortable now. The other thing to know is that Parkinson's, we have no other really effective drugs. Drug companies are always trying to find out something that's going to make a difference. Not so. They just came out with a new drug for Alzheimer's, which they're trying to put over on the public. I wish I'd have brought the name along, but you'll hear it on the commercials. You'll read it in the newspaper because it's just trying to get approval. It's for Alzheimer's. And what it does is it cuts down the deterioration by about, I think they said 37% over a study period of time. Well, in the lecture that I give on aging, I talk to you about using desferoxamine. you know it as deferoxamine.
Yeah.
But desferoxamine, where they did a study in the 1980s where they cut deterioration in half. But the difference is this is a generic drug, which is pennies compared to the new drug that they're going to charge you thousands of dollars for. So you're going to hear about it.
Is it going to work?
I don't know. I mean, if it does, it's not going to work as well as desferoxamine does.
Okay.
But they should have been selling you desferoxamine. You know, Alzheimer's is, of course, different from Parkinson's, but both of them are reasons for dementia. If you want to hear that lecture, we're going to do that lecture again, Heather. We've done it twice. We've sold out crowds twice.
We will, but not till next year. So they're going to have to wait.
Yeah. In the meantime, in November and December, we're doing a 4-part series on nutrition, on human nutrition, and what the correct diet is for people. And I have for 16 hours. It's going to be 16. That includes question and answers. There are going to be 16 hours of education on protein, amino acids, fats, essential fats, fish fats, and carbohydrates, sugars, potatoes, rice. And also there's going to be a lecture on vitamins and minerals and vitamin D. 4 lectures, and we're taking enrollment for it now. Hopefully we'll sell out soon and we'll be able to schedule another one for next year. But these are live lectures, both the aging and the dementia lecture, which I talked to you about in terms of, dementia. And as again, they were very successful. We sold out both times we held it. We'll do it again.
Yeah, they
the
were
nice
fun.
thing is, the nice thing is these days, and I spent you didn't ask me how I spent today, Heather. I spent today bringing up the research papers on the protein lecture. I probably have 2 weeks. See, you know, these lectures, which you may have heard part of it before, some of my discussion before, they're all being updated and well organized and adding a big bit of the science, so that next time you get into an argument with somebody about vitamins or protein or fats, you can take the cards from the deck. I call them the slides from the presentation. With all the references and the description of what's going on, you can hand it to your friend. Look, you don't think there's all the essential amino acids in plants? Look at these 2 cards. Look at the references. Anyways, you'll never, if you're taking this course, you'll never lose another argument about protein, amino acids, fats, vitamins, minerals, B12, etc. I guarantee it. If you lose, then I'll step in. But anyway, that's what I'm spending the next month, is getting these four days of lecture organized.
And I shared the link in the chat if anyone is interested in finding out more about those. Okay, next question. This is actually a follow-up question from last week. This is from Karen. We talked about how she and her husband both developed cancer, and she's wondering, they live on a golf course, and she's wondering if the cancer could have come from all the pesticides. And
why not? I mean, you know, these cancers of the breast, you know, of the uterus, of the prostate, these are due to a large part, you know, the research. If you're going to look at the volume of research, they're due to environmental pollutants, environmental chemicals that initiate cancer. They damage the DNA, and they promote the cancer. They have some of these chemicals have estrogen-like effects, and you know, they stimulate the cancer growth. So yeah, I don't think you're going to win a lawsuit, but I think you'd win a scientific discussion on the pesticides and other environmental chemicals. Look, grief, there's hundreds of thousands of different chemicals that are put out by industry that they told us wouldn't hurt us. You know, just like we played behind the pesticides when we were kids, because Monsanto or whoever was putting them out said that they wouldn't hurt us. We believed them. Stop believing these people.
Thank you. Next question. This is from Jerry. She would like to know what your recommendation is for the treatment of a trigeminal neuralgia.
Trigeminal neuralgia.
There we go.
Trigeminal neuralgia. That's the 7th nerve, which is the facial nerve. And it would be like it would come across like this. That's where your facial nerve comes. No, I don't have an effective treatment. I certainly would encourage you to eat well, of course, but I can't tell you any particular cause and effect with diet. But I can't tell you any evidence of remedy of the problem by eating potatoes or sweet potatoes. You know, what you want to do is you want to clean up things as much as possible so the next thing doesn't happen to you.
Thank you. Okay, next question. Can we get into acrylamides a little bit? Are you worried about those?
Nah. Yeah. Again, I've written about this a lot in the newsletter. Acrylamides are sugar protein moieties that are created by heating carbohydrates above 240 degrees Fahrenheit.
So didn't they talk about them with like French fries and things that were fried?
Right, and frying does that. If you boil, you increase it to 210, so you don't run into the conversion of these sugars and proteins into acrylamides. Okay, and acrylamides have been shown in the laboratory as to be cancer causing. The thing is that in epidemiologic data, where they look around different populations of people, they don't see cancer being caused by acrylamides. And to me, it's just an argument that allows people to say, why should I bother? Nothing's safe to eat. Now I can't eat potatoes or carbohydrates or starches. Well, you need to know, first of all, it's not become a worldwide problem or no connection. It's mostly theoretical and in the laboratory. And second, it's for the high heating of carbohydrates. So don't heat your potatoes. Don't fry them. I think we don't recommend you don't fry potatoes. Don't we recommend that?
We don't recommend frying.
Yeah. So acrylamide. You'll find a more thorough discussion on the website.
So that brings up my next question from Queen. She understands the whole no animal product part of our diet, but why the oils?
There's a whole 4-hour session I'm going to give on that. I think it's November 17th or something on oil.
That's important because everybody wants to know that.
That's why it's lecture number 2. The first lecture is where do I get my protein? And it's going to deal with calcium at the same time. Where do I get my protein? The second set of lectures is going to be about oil, fats, good fats, omega-3 fats, fish fats, flaxseed oil fats, etc. fats. First you have to realize oil does not exist in nature until you process. Okay? It never exists freely in nature. You've got to at least take the stone and press the olive to squeeze the oil away from the other components of the olive. So it's a manufactured substance. Sometimes it's medicinal. It has pharmacologic effects that you may be looking for. Like it thins the blood. Makes your hair nice and oily. I don't know. I had one person who's told us he liked his oily hair. And he wanted to know if he had to give up the oil because I said, no, just put it on your hair. Oil is the most calorie dense of all the components of the diet that we come in contact with. Oil is 9 calories per gram. Starches are 1 calorie per gram. 9 calories per gram. The oil, if it's omega-3 fats, it causes bleeding, suppresses your immune system, increases your chances of getting an infection, promotes cancer. And we're going to talk about that. These oils are toxic. And if you happen to get them from fish, and we're going to talk about that in this lecture, you're dealing with eating fish or fish oils, which will cause you to be laden with methylmercury, a known toxin. I can tell how much fish you eat just by simply getting a blood test and finding out how much methylmercury is in your body. I can tell how much fish you eat because that's where it comes from the fish. And if you eat fish oils like max EPA, methylmercury, and it raises your cholesterol. Fish oils do. They don't lower. They raise
the one that I think is most important is the one where you say it suppresses the immune system.
Yeah.
People don't realize how much your immune system does for you.
I mean, like keeps you from getting infected, keeps the cancer cells that develop from
Yeah.
getting big.
I mean, there's just so many things.
Right. If it goes-
Arthritis. It just, your immune system is really important.
Well, start out by the understanding that it does not exist in nature. Okay.
The free oils.
The free oils don't. And that's what we're talking about. Their oils are essential. I mean, you have to have, there are certain essential fats, and they're all made by plants. There's the conspiracy. They're all made by plants. Just like all the essential amino acids are made by plants. You know, anyway, all the 11 of the 13 vitamins are made by plants.
Well, and people are surprised to hear that there's oil in carrots and corn, and there's oil in everything, but it's how the oil should be packaged, just how it's supposed to be.
Right, and the right packages, not only is it not dangerous, it's necessary. You know, your creator did not put it in the food by mistake, but when you take it out, you're violating the laws of Mother Nature, and you're going to get in trouble. So,
all right, well, we've
about
run out of time. I can't believe it. That hour went by fast once again.
If people would like to keep these 5 o'clock sessions going, then tell your friends and relatives. Well, this is our chance to offer you in the community, no charge, an opportunity to learn about the program, ask us questions. So send in questions early for Heather, and you know, join us for some of the more intense educational experiences, like, you know, the seminars we're giving on nutrition, the 4-day seminars. And you got a program coming up pretty soon, Heather?
October 14th.
So if you've just had it, you're sick of taking these drugs, you're sick of visiting the doctor, you're sick of getting sicker, well, let us help you. We have a 12-day program that has a professional staff that, you know, people can hardly believe we could gather so many great people together to help you. And we'll take care of you from your medical issues all the way through, and work with you all day long. And then we'll take care of you for a whole year. A whole year we have access to you, with you. And what kind of support are you going to get anyplace else like that? Anyway, think about the 12-day program if you just are tired and fed up. And get your friends and relatives to come see us on Sunday nights, okay?
Absolutely.
I'm as lonely as the Maytag repairman when it comes to me seeing my patients. Don't make me that way when it comes to doing my free interviews.
I love it. Well, that was fun.
All right.
Thanks, Mom and Dad, Dr. McDougall and Mary. Thank you, everyone, for being here. We will see you all next Sunday at 5 p.m. Pacific.
Bye-bye.
Have a great rest of your day. Bye, everyone.
Bye, everyone.